Good morning. So we are going to discuss on the anti-hyperlipidemic drug. So basic thing, what is the metabolism of the liver and all we have discussed into our previous video. Now plasma lipoproteins. Now whenever we are talking about this, plasma lipids are transported in a complex called lipoprotein. Already we have seen metabolic disorder that involves elevation into the lipoprotein species are termed as a hyperlipoproteinemias, hyperlipidemias. Hyperlipidemia also donates this lipid increased into the level of the triglyceride. Now, what are the different drugs are used into the treatment of the hyperlipidemia? So first one is the statin or HMG-CoA reductase inhibitor. That is the different types of the statin like atorvastatin, lovastatin, simvastatin. These are the different types of the drug are under the class of the HMG-CoA reductase inhibitor. Next is bile acid sesquiterpenes, that is the resins, that is the cholesterol or cholestyramine. These are the drugs are there. Next is lipoprotein lipase activator, that is PPAR alpha activator or fibrates, that is the clofibrates, Gemfi, Brazil. These are the drug. Phenofibrates are the very useful drug. Next one is the lipolysis and triglyceride synthesis inhibitor, nicotinic acid and sterol absorption inhibitor, that is the amezitib. So these are the drug clear. Either it may be the atorvastatin, it may be the cholesterol, it may be the clofibrate, it may be the nicotinic acid, or it may be the imzatimib. We are going to discuss their mechanism of action. Now coming to the HMG-CoA reductase inhibitor or the statin. Now here it is important that acetate, if you see about this cholesterol biosynthesis in the liver, already we have told, and we have told that one of the process into the synthesis of the cholesterol biosynthesis is from the acetyl choline. Now this acetate, it will convert into the different steps. Here we are not showing all the steps, but it will convert into the different steps and it will convert into the HMG-CoA. Clear? HMG-CoA. Now, in presence of HMG-CoA reductase, here in presence of HMG-CoA reductase, it will converting into the mevalonic acid, and again mevalonic acid through the different steps it will convert into the cholesterol. So this is the process. So acetate to cholesterol, and here the what is the important enzyme, that is the HMG-CoA reductase. Let HMG-CoA reductase here. Now, whenever we are giving the statin, how they are going to affect? Now, statin, they will inhibit the HMG-CoA reductase. Clear? HMG-CoA reductase. This HMG-CoA reductase, it will be inhibited by the statin type of the drug. Now, if they are inhibiting the HMG-CoA reductase, then what will happen? That leads to the decreased concentration of the cholesterol inside the cell. Clear? Decreased concentration of the cholesterol inside the cell, because this is one of the major process in the cholesterol biosynthesis, and if we are stopping that particular process, of course you can say that cholesterol level it will be reduced. So this is the mechanism of action of HMG-CoA reductase. Next is bile acid sesquiterpenes or the resins. Now these are the basic ion exchange resins. So we need to understand that these are the basic ion exchange resins supplied into the chloride form. Like they are supplied into the chloroform. They are neither digested or absorbed into the gut. That means after administration they are not digested or absorbed into the gut area. Bind to bile acid into the intestine and interrupting their enterohepatic circulation. So here if we are telling that this is the liver, formation of the cholesterol and all. Now this cholesterol also responsible for the synthesis of the bile acid. Now these bile acids, it is enter into the gut area. Clear? Enter into the gut area and they will excrete, and again a major portion of the bile acid again it will go back into the liver. Clear? Again it will go back into the liver. Now whenever we are giving this resins type of the drug, they are going to inhibit here. They will bind to this bile acid. They are going to bind with the bile acid and they will increase, you can say that inhibit the binding of the they will inhibit the you can say that entering into the bile acid to the liver. So here we are telling that they are interrupting the enterohepatic circulation. Clear? So what will happen to this bile acid after binding to the resin? They will excrete it. Clear? They are going to excrete it. So bile acid, it will not going back to the liver, but it will be excreted after binding to the resin. So fecal excretion of the bile salt and the cholesterol, which is absorbed with the help of the bile salt, is increased. So it is because it consists of the cholesterol. So you can say that fecal excretion of the bile salt and cholesterol, which absorbed in the help of the bile salt, is increased. This indirectly leads to the enhanced hepatic metabolism of the cholesterol. They will indirectly lead to the enhanced hepatic metabolism of the cholesterol to the bile acid. More LDL receptor are expressed, because see, LDL receptor is again important for the cholesterol biosynthesis. More LDL receptor, it will be expressed into the liver cell. As a result, clearance of the ideal LDL, because the ideal and LDL through the LDL receptor is necessary for the cholesterol synthesis. Now, if the cholesterol, it will form bile acid and then it will be excreted through the gut, then of course again we can say that more LDL receptor, it will be exist, more LDL, it will be taken up, ideal, it will be taken up from the plasma. So by that you can say that mechanism these resins are acting. Next is nicotinic acid, which is lipolysis or triglyceride synthesis inhibitor. Now it is a B group vitamin, and which is much in which is much larger dose reduce the plasma lipid. So it requires the more dose. Now nicotinic acid reduce the production of VLDL in the liver. It will reduce the production of the VLDL in liver by inhibiting the triglyceride synthesis. Triglyceride synthesis. So here, so it will inhibiting the VLDL synthesis. VLDL, because we have told protein, triglyceride, and cholesterol is required for the VLDL synthesis. Already we have seen. So we can say that they will inhibiting this VLDL synthesis by inhibiting the triglyceride synthesis. Indirectly, the VLDL degradation products. See, VLDL again, it will form the IDL and LDL. So if the VLDL production it is reduced, IDL and LDL also it will be reduced. No direct effect on the cholesterol and the bile acid metabolism. So here they do not have any effect. Clear? They do not have any effect. They inhibit intracellular lipolysis in the adipose tissue. Clear? In the adipose tissue, they will be inhibiting the intracellular lipolysis and increase the activity of the lipoprotein lipase that clears triglyceride. Clear? That you can say that lipolysis that clears the triglyceride. So these are the drugs are used. You can say that like Zemfibrozil type of the drug. They are also, it is useful. So this is about the nicotinic acid. Next is fibrates. Fibrates also known as the lipoprotein lipase activator. Now these are the possible way of action of fibrates. So what they are doing, they reduce the level of the plasma triglyceride. So fibrates reduce the level of the plasma triglyceride. They reduce the chylomicron and VLDL RAM10. They increase the LDL size. They increase the level of HDL. HDL is a good cholesterol. HDL is a good cholesterol. They increase the reverse cholesterol transport. So they are increasing the reverse cholesterol transport. Direct anti-inflammatory effect on the artery cell, because it may be happens due to the plaque formation. So they direct the anti-inflammatory effect on the artery cell and direct the anti-inflammatory effect in visceral fat. So these are the possible mechanism of action of fibrates. Clear? Fibrates. Now last one is the sterol absorption inhibitor. Now in case of the sterol absorption inhibitor, that is the ezetimibe. Now in case of the ezetimibe, what will happen? Their action on the intestinal sterol absorption inhibitor, they are going to here. They are going to we are considering them as a sterol absorption inhibitor. Now this particular drug, it is a unique drug that inhibits the absorption of the dietary cholesterol. They are inhibiting the absorption of the dietary cholesterol. Gut area from the dietary cholesterol absorption, it will be inhibited. After oral administration, this imezatimib, is absorbed from the intestine. Yes, they will absorb from the intestine and then mostly converted into its pharmacologically active compound, that is the ezetimibe glucuronide. Yes, so that is the active compound. So they will be forming this active metabolite, and this metabolite distributed into the circulation to the small intestine where it is localized. So it is small intestine and the circulation, and there it will be localized, and they are going to inhibit the absorption of both biliary as well as the you can say the dietary cholesterol. So this is also a very important drug. So these are the different drugs we can use as a treatment of the hyperlipidemia.